So what I want to do now is talk a little bit about the effects of social isolation. Fortunately or unfortunately, we have some experience and knowledge from previous outbreaks as to the effect that isolating oneself has, both short-term and long-term. And out of the SARS pandemic research, what we've actually been able to come to understand is that social isolation does have a serious and lasting effect on the mental health of healthcare workers. And what we have found out in the research is that social isolation is highly correlated and predictive of the development of some psychological disorders, including acute stress disorder, increased levels of depression, and coping, numbing themselves using alcohol. But what we also know is that 3 years later, the research says that individuals that were quarantined, socially isolated, were at higher risk of developing post-traumatic stress symptoms. That these avoidant behaviors also prevented a large number of people from returning back to their role professionally, and many of them stepped away from their patient care role as well. And in an overtaxed, highly utilized, very stressful, often short of the most important resource, which is the personnel, I think that taking measures to limit the loss of our frontline workers, we need to address that sometimes what we are asking them to do, insinuating what they should do or forcing them to do with this social isolation and quarantine, is going to have an impact on their ability to come back and return back to their normal job once the pandemic is over. And so that's come out of the SARS research, that 3 years later, that ripple effect is still there. So for those people that think that, in a month or two, things will return to normal, what we do know is for a number of people, 3 years later, things continue to be very abnormal, that they're having a normal reaction to what is really an abnormal blip in the world. And so understanding this, again, helps us understand the importance of creating as much as we can using novel and in unique ways to connect with each other, to limit that sense of isolation, and to support each other and come together in the community that you work.